I see you have been talking about health issues along with the usual romance stories. This prompted me to share with you the difference between the Thai and Australian health systems. I have been married to a Thai for 17 years and have travelled to Thailand 28 times. So I've had frequent interactions with the Thai health system, dental visits, doctor's appointments, surgery and emergency procedures. I also worked in the Australian public health system for 13 years, so I'm very familiar with both health systems. I recently read this article on SBS News that found that your first visit to a dentist involving just a checkup and an x-ray with no actual dental work taking place costs between 300 and 400 Australian dollars, depending on what state you live in. I might also add that you could wait any time between a week and a month to see a dentist in Australia. Compare this to Thailand, where a dental checkup in Bangkok is free and you can see a dentist at 9 p.m. at night immediately, no problem at all without an appointment. My Bangkok dentist charges about 700 baht for filling, descaling, cleaning, 1,000 baht tooth extraction, 1,000 baht for wisdom teeth extraction, 10,000 baht to have this done in Australia would be approximately $200 for the filling. Descaling $150, extraction $250 to $400, wisdom teeth extraction $1,400 to $2,500. Naturally, if we need dental care, we have it done in Thailand, and our trips to Thailand always include an obligatory dentist visit. Just in case, medical care in Australia, a few months ago I was in a lot of pain with my shoulder. I couldn't sleep with the pain, I couldn't move my arm. I tried to make an appointment with my usual doctor. He had no available appointments until 3 weeks. I contacted another doctor, surgery, and was told either that they were not taking on new patients or an appointment would be available for at least 2 weeks or wouldn't be available. After much ringing around, I found a doctor who could see me in a couple of days. My Thai wife was furious as she kept saying in Thailand a doctor would see you right away. I don't understand why your health system here is so bad. After seeing the doctor, I was referred for an ultrasound. I couldn't get an ultrasound appointment for 2 weeks. I did a lot of ringing around and eventually found a clinic that could do it in 3 days. The ultrasound revealed partial shoulder tendon tears and calcium deposits were causing my substantial pain. Another doctor's appointment. Next, I was told I would need an ultrasound guided injection into my shoulder joint and removal of the calcium deposits at the same time. The city where I live has a population of around 70,000 people, and there were no available appointments for the ultrasound injection for 6 weeks. I was in a lot of pain, so I asked if there was any way it could be done sooner. The answer was yes. If you drive 50 kilometers to another city, you could have it done in 3 days. Short answer was yes, I will go to the other city and I received the treatment I needed. All these medical dramas were making us think we should just fly to Thailand to answer. Truthfully, yes, it would have been easier and quicker if we had had medical in Thailand. I got very sick with asthma in rural Thailand and was having difficulty breathing. We drove to Nakhon Sawan and arrived at a large private hospital at 8:30 p.m. on a Sunday night. I was seen within 15 minutes by a doctor who arranged an x-ray, PCR test, and then had me treated to ease my congestion and open up my airways. I then was seen by the doctor again, and she discussed the x-ray which had been reported on by a radiologist, and I was discharged with all the medication I required. From entering the hospital, receiving treatment and leaving it took 80 minutes and cost around $150, including medication. At the hospital where I worked in Australia, it can take 3 to 4 hours just to be seen by a doctor in an emergency department. And there is no way you would have a radiologist's report on the same day. Try a week if you are lucky. On another occasion, I got a bad asthma attack in rural Thailand and went to a public hospital, and I was seen immediately and given medication for the principally sum of 200 baht. My friend's cancer treatment in Australia, a friend was diagnosed with a very aggressive prostate cancer. He was told that his cancer, on a scale of 1 to 5, as regards to seriousness and chances of spreading throughout his body, was a 5, the most dangerous. Yet, in spite of this diagnosis, he had to wait 9 months to get a PET scan. I pleaded with him to go to Thailand and get it done there, where they could do the PET scan within a few days, but he insisted on staying in Australia and waited the 9 months. Once the PET scan was done, it confirmed the seriousness of his cancer and had his prostate completely removed. After another 6 weeks wait, and that was a private patient, he had to pay over $20,000 to get this treatment. He is still waiting to determine if his cancer has spread to other parts of his body. If he had gone to Thailand, it probably would have been done for less than half the price, and he would have been treated 9 months earlier, and so he could have had a better income. Our thoughts on aging. My wife and I have decided if we ever need urgent treatment, we will get on a plane immediately, go to Thailand, as it isn't worth the risk to rely on the stretched Australian healthcare system. When we need care, we will move to Thailand permanently, as we have no faith in the Australian aged care system. We have insider's knowledge as my wife works in aged care in Australia. I experienced what aged care was like in Australia through my mother's care in what is the most exclusive and expensive private nursing home in Brisbane. And it wasn't good. I hope you and your viewers find our story interesting and it makes them think of the real and the better health alternatives Thailand provides. Well, he is absolutely right, but the problem is not everybody's got the availability to jump on a plane and go to Thailand every time they're sick. And but it is true. It's the same in the UK. I mean, we have the NHS National Health System, which supposedly is free. We've paid taxes for it all of our lives. But you wait weeks and weeks and weeks. I know people who go in for, they need hip replacements, knee replacements, things like that, and they wait months and months, if not years, for an appointment, and then it gets cancelled at the last minute, and they have to wait more months. In Thailand, the dentists and the hospitals are very, very good, but you do pay for the service. I myself have just recently moved from one private hospital to another private hospital, and I've decreased my costs by 50%, and it's still a good hospital. I think I mentioned it before. So yeah, there's a lot of people also who use Thailand. They're kind of we call medical tourists.